This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to talk about why in the United States we need transparent cash-based pricing for surgeries. So I'm an orthopedic surgeon, and this is something that I offer, but it's not something that a lot of other places offer. You have Oklahoma Surgery Center, you have St. George's Surgery Center out in Utah, and there's a few others. But if you're a patient and let's say you're a small business owner and you don't have insurance and you get hurt, there are just not a lot of good options. There's surgery centers all over the country, but for whatever reason, none of them want to take cash, or if they do, they can't quote you to how much it'll be. So I'll give you an example. So I just fixed a distal radius to a wrist in somebody, and we were able to charge them $6,500 all-in cost. That includes the facility, the anesthesia, my fee, and the implant cost. I doubt you'll be able to find it for much less anywhere else. But that's what I quoted him, and we were able to do it and help him out, which was great. But the hospital where he was quoted him $29,000, and that didn't include facility fee, which is usually the most expensive part, and that didn't include anesthesia. So you're probably looking at a $50,000 surgery, at least, maybe more. I mean, who knows? And for that price, he was just going to let his wrist, heal poorly and be messed up. So I'm glad he found me. But that's the kind of state we're in. And these surgery centers or other places are just built for insurance billing and all that junk. You go into their offices, they're huge and it's all filled with coders and billers, but at the same time, they can't give you a cash price that you can get your surgery done for. It's absolutely insane. Or if they do, it's not binding. And in my book, a non-binding price is essentially worthless. I mean, because it could go anywhere. It could be a lot more. This is enough to bankrupt you. So I find it kind of crazy that I'm one of the few people doing this. And, we really need more surgeons and surgery centers to do this and move to this area of cash pricing. It's better for people that don't have insurance. And you know what? It's better for some people that do have insurance if their deductible is sky high. So, it's just taking time and mentality switch for people. They say, yes, I have insurance, I'm fine, but are you? Your plan may not cover a lot of things that you get done. Your network may be paper thin, your deductible may be sky high. What value are you really getting? So I'm happy to be some provider who does some of it, but I don't do everything. And, we really need more. But it's certainly frustrating for me that there's not more options, and obviously frustrating for the patients that I treat too until we find each other. But I just don't see this problem going away anytime soon. I basically see hospitals getting larger and larger, and this just being pushed more, this situation being more marginalized. And, the prices for these surgeries are astronomical. So I don't know what really we need to do about it besides having more independent providers like myself kind of create these centers. But we got to do something because it's not really sustainable the way we're going. So I hope you enjoyed my video. If you have any questions or comments, please leave them below. I'll do my best to respond. Please like and subscribe, and thanks for watching.